to this video presentation of outcomes assessment. This video 3 will provide examples of learning outcomes and assessable criteria. This video 3, is going to focus on some sample learning outcomes that you might consider for your program, whichever program it may be, and also the criteria that you might consider assessing within each of those outcomes.
So, Fred, I'd like to ask you to share your experience on how Kansas State University decide their institutional learning outcomes.
Yeah, I'd be very happy to. The way we look at it at Kansas State University is the center of all learning outcomes is the program itself. Each program defines what it means for their students to get their diploma. That means that they have certain aspects of knowledge that they have attained in relationship to their particular discipline. And these are assessed in various ways, such as multiple choice exams, essay exams, verbal presentations, or any ways that the students demonstrate knowledge. Now, I do want you to recall what we talked about knowledge in the last video. Each program also looks at the particular competencies and skills like we talked in the earlier video. And these are the skills that students need to succeed, these skills that they can transfer into their future occupations and be able to apply. And these are assessed very often in projects or internships or some type of applied experience through which the students are putting into place and demonstrating that they can take the knowledge and apply it. And then finally, these professional dispositions, aspects of leadership, aspects of making ethical decisions within a particular workplace, being able to interact effectively with colleagues or with future clients or patients. It is essential that we do not just assess knowledge, because knowledge needs to be applied in a specific context. We at our university don't look at institutional outcomes as separate from program outcomes. We look at program outcomes as the indicator of that institutional outcome.
所以在这一个 PowerPoint slide 里面，我们所介绍就是确定系所在决定系所学生学习成效的过程之前，确定能够包含这3个主要的项目，就是不只是着重在知识层面，还有就是技能层面跟特质层面。如果能够把这3个平衡列出的话，学生在毕业的时候可以展现出更多元化的水平，而不是只会纸笔测验。那在其他的技能上面无法跟人沟通，有效的沟通，或是写，或是做一些不同的分析。那还有另外一个最主要的就是我们要如何训练学生在特质上面更能够顺利的适应职场上面的变动。
We looked at several dental hygiene programs in the United States and found a few learning outcomes to use as examples. So one example is a focus on students' assessment skills in dental hygiene. The students will demonstrate appropriate oral health assessment skills. So you want to think about what skills students need in the workplace and place those as the outcomes that need to be assessed somewhere within your program. Here's another example. Students' diagnostic skills to demonstrate the extent to which students can understand and apply the knowledge. And they often do that by diagnosing oral health conditions or problems. So you think about your program, how do students take the knowledge that they have learned from your classes and apply them into making evaluative or diagnostic decisions? Here's another example. The capacity for a student to interpret a diagnosis with consideration of the patient's needs. This requires critical thinking. Now, when we're talking about an institutional outcome of critical thinking, The way this is demonstrated in your program of dental hygiene may be a little bit different than the way it's demonstrated in some other health profession. So the important thing is that the institutional outcomes are demonstrated in the way that's appropriate for the discipline. To administer patient-centered dental hygiene, this is where the students have to demonstrate interaction between the doctor and the student, even professional interaction between multiple physicians. And each of those would be assessed in their own unique way in application. Here's another example. Evaluate how effective that care plan was, or how effective the patient care was. So we want to look at all the levels of application that's required of students. One final one. Appropriately document information. The ability to document information is a particular type of written communication skills that needs to be assessed. This is how we connect institutional outcomes with program outcomes. Each of these type of skills need to be assessed in the appropriate way that fits within your discipline.
从这几个学生学习评估的范例里面，你可以看得到，就是它在各个层面上面有包含cover 在知识层面、技能层面，或者是特质层面，每一个学生学习评估的指标列在这边的，都可以额外在细部分出。这一个可以用不同的方式来做评估，所以每一个学生学习评估，它所测量的是多层面跟多元化的。那如果系所能够有这种多元化的学生学习评估的概念，包括在这个整个过程当中所评估出来所得到的资讯跟可以跟各位老师做研讨的，每一年做研讨的跟改进的项目会比较有效。所以就是我们之后会提供比较在接下来这几个 PowerPoint slide 里面，我们会提供如何去拆解每一个 learning outcomes and how each learning outcome can be break down into a different element and how each element can identify a different measures to support that investigation.
I'd like to take one step back and look at the overall assessment process to help you understand how everything fits together. Each outcome is a category in and of itself. A learning outcome will develop written communication skills, or possibly will understand the knowledge associated with surgery. Those are things that directly are not accessible. We call those latent constructs, meaning there's no direct assessment that defines this is what written communication looks like, or this is how students need to be able to write effectively. What we need to rely on is the second level of criteria. What we assess are the indicators that students can demonstrate of the learning outcomes. So in other words, within understanding the concepts within patient care, there are multiple ways that students can demonstrate how they have the skill and knowledge associated with patient care. It is the criteria that we assess that become indicators of the learning outcome. Now, most of the time when we assess these, it doesn't always happen in the form of a knowledge test. If we want to know how students can apply patient care, we wouldn't ask that in a multiple choice question. We would want students to demonstrate in the act of patient care. This is where the assessment task becomes essential. These are those assignments that you maybe do throughout your course, or maybe at the end of your course, you have a situation where students will apply the knowledge. This is the place where you want to collect assessment learning information, in which students directly demonstrate these accessible criteria, which are indicators of the overall learning outcome that you are assessing.
就是在这3个不同的项目当中，可以明确的提供更有力的一个方针，就是学生学习评估的一个大的方向是不是能够直接去做评估的。例如说，如果你要测学生的critical thinking、problem solving，那个只是一个大方面的一个潜在的一个概念，你需要用不同的细目的部分来去定义如何去更有效的去分析学生学习评估的部分critical thinking including a criteria 1, 2, 3. So by using those 1, 2, 3, it gives you a better idea how to measure. 那下面的另外一个是 criteria 的部分，因为有些学生学习评估的部分没有办法直接去做纸笔的测量，学生需要有一个scenario 来做 demonstration。譬如说，学生在医院里面实习，这个东西是没有办法直接从纸笔测验去说，第一个步骤问题是什么，答案是什么。那老师需要从观察的方式，学生直接去做进行一个 scenario demonstration 的方式来测验出学生是否有到达我们的评估的标准。那另外，在测验的过程当中，老师也要明确的分析说，有这个测验的过程有哪几个 criteria 的部分是分别是在可能是用scale 或者是用 percentage， 这些部分都可以提供更有效的测量的资讯。那进而让系所知道如何去做不同的教学或是学生学习的一个配置，如何就是确定学生真的是学到所学。那如果没有学到所学的话，老师跟系所之间是如何去做一些更改，来确定learning occur at the end.
Outcomes in the area of knowledge and skills can be divided into multiple assessable components. These are those criteria. In this example, we've taken 3 outcomes and we will discuss possible assessable criteria. You can see the assignments that score recognition of anatomical anomalies of the bones, soft tissues, teeth, systematic conditions are all indicators of oral health. In creating an assessment, you of course would want to identify that students know this knowledge and can identify the difference between these knowledge components.
从知识层面上面来看的话，我们用这个例子，这个知识面的学习评估的learning outcome 可以分为从就是最基本层面的，就是学生是如何去发现、去发掘哪些重要的知识相关的概念是学生需要确定能够identify 出来的。
And of course, those are knowledge components which can be demonstrated in a multiple choice test or demonstrated in a laboratory with students pointing things out to identify. But beyond that, students can take that knowledge and explain a radiology technique or identify errors or possibly be able to analyze whether a treatment plan has been successful. And these are the indicators that you would want to assess.
从第一个部分就是学生可以我们可以用纸笔的测验来测量学生是否学到该所学的。那在下一个的部分有包含更进阶的demonstration， 就是学生如何去解释，如何去分析。那之后的话，分析之后，在下一个的例子就是如何了解、分析，进而应用。所以我们希望在每个学生 learning outcome 的，即使说只是在 knowledge base 的，也有这种从基本的层面、中层面跟高层面。如果 系所的 learning outcome 能有这样配置的话，可以看到更多多元化的资料，来借由这些资料来做不同的分析。
I think you can see that everything we've shown so far could be assessed within an examination. But if you wanted to know that a student could actually create a comprehensive treatment plan, an examination would not be the only assessment you would use. We would want to move forward and see that the students can actually not only identify a treatment plan, but they can perform the services to address the appropriate outcome category. So in other words, there are many ways to assess student learning beyond their knowledge of, but to assess that they can take that knowledge and put it into action. In other words, perform safe, effective, and ethical hygiene services. When defining learning outcomes, your program has learning expectations that go beyond knowledge and skills. This particular outcome and the assessable criteria that we're going to talk about define students' ability to demonstrate research and problem solving. All of the criteria that we're going to talk about could be assessed in a single research project, as long as each criterion provides an independent score from one or multiple assignments and can demonstrate levels of achievement. If you wish to develop skills in problem solving through research, you probably want to assess the student's capacity to apply knowledge and skills that they learn, demonstrating and assessed through how they apply it in a research or scientific methods. You might also wish to develop and assess students' capacity to identify and diagnose problems within your discipline through investigation using applied techniques from your discipline. You see that this now is different than knowledge of problems. It is going and searching and finding answers that aren't readily within their knowledge, being able to identify what is the problem that needs to be solved and where can I go get answers. Another criteria to assess is students' capacity to apply particular methodologies to understand the options of treatments. And then another criteria that you might want to address is their capacity to creatively develop and apply practical solutions to the problem. Each of these criteria are unique components to problem solve. They're not one thing, but it's 4 different things used in a sequence within an assignment. So when you design assessments, you would want to be able to assess not all at once, but as students are moving through each step, and each step would have its own assessment of that particular criterion.
这个特殊的 learning outcome 是应该算是所有的系所都会列在他们的系所的学生学习目标之内，然后就是不管说从大学部或者是研究所都有这一个，而且我们把这个部分分析出来4个部分，就是 apply、identify、use 跟 develop。在这个4个部分里面，除了可以整体的来做资料的收集之外，每个部分的收集的 subcomponent 的资料，可以提供更多明确的讯息给系所，就是如果学生在 apply 的部分有80%达到我们的基本标准，那系所就可以去考量说，这些80%是只是仅仅得到该有的呢，还是学生可以再做得更好？那另外20%的部分，学生为什么没有做好？是什么地方可以再做改进？所以这些 criteria 可以让系所的老师更明确的了解 apply 的部分如何加强。那在下一个部分就是 identify 如何当你每一个步骤都有分出这些细目的时候，每个细目的部分又有明确的 criteria 指标，所以所有资讯资料收集下来，不是只是一个整体的一个 score， 那你也可以 break down 在这个4个 criteria 之内，如何看到不同的发展跟分析。所以我们会这个也是我们在这边指导各系所在做学生学习评估的时候很重要的一个步骤。
I'd like to add one more thing about this. If you're concerned a bit about students' motivation, it's much more motivating for a student to be given a problem and having to go through the aspects of solving that problem than it is to sit down and answer questions. An essential component of learning in every discipline is career development. The components associated with knowledge, awareness, and preparedness for the future can be assessed through appropriate criteria and an appropriate assessment task. There are many aspects of learning for which the program is responsible to teach and to confirm that students have learned. One criterion you can assess is students' ability to recognize clinical conditions and situations that they will encounter in their future profession, and the levels to which they can pursue and successfully achieve this in their future. All fields of study, especially in the sciences, require skills and initiative to pursue lifelong development and enhancement. Students must recognize the professional organizations and career development opportunities and demonstrate the desire to improve themselves. These indicators can and should be observed and assessed while studying in your program. And then the knowledge of professional ethics and ethical decision-making in practice is an essential learning criterion to be developed and assessed. When assessing professional ethics, this must be assessed both as knowledge and as applied skills.
这也是用不同的案例，就是同样的一个发展的一个过程。那尤其是在医学院的部分，很多系所要确定学生在毕业后能够实际的在医院里面做操作型相关的。那有一些部分是如何去在课堂上面能够有效的发展，就是学生有办法去 recognize what are the issues。And then identify and also be able to explain. 所以这几个过程的发展对于学生的 career development 是一个非常重要的一个关键。
Within most tasks through which students demonstrate competencies are a means of interpersonal interaction and communication. When you're scoring developments, let's say, of a care plan, the written communication skills appropriate for the task should also be assessed with its own scoring criterion. When you're observing students administer a patient care plan, you can assess students' ability to verbally interact with patients, as well as interact with other doctors and staff using specially designed criteria and achievement levels.
所以在这个部分，就是所有的听说读写观察跟做不同的documentation， 让学生能够更胜任在医院里面所需要相关的skill set。
It is important to clearly organize the criteria and outcomes so that they can be aligned with courses and appropriate assignments at the university level. Your program has already made progress in developing some of the outcome structure and aligning these selected assessments with essential components for collecting achievement scores.
就是现在用的这个案例，就是之前我们有提到的，如何在一个大的一个 category 口腔预防保健，那如何从这个大的方向再细分出不同的 criterion， 那就有 A1、A2、A3， 那每一个细部又有特定的 keywords 去 attach to it， 像第一个部分。学生如何了解口腔保健概念及重要性，这个就是在知识层面，但是靠近了解的一个部分。那如何运用，如何去规划，这些就有不同的。那如果每一个 category 里面的细部能够有这样子从 减到从 basic 到 more advanced 一个 level 的 development，那学生的学习发展跟老师的教学指导上面的话，会有一个很明确的一个规划。那就以这个案例来说的话，如果每一个 learning outcome can be also break down in using this type of strategy 跟layout，我们从课堂里面跟系所上面所得到的资料是非常非常另有价值的。
This is the end of the third video. The next and final video will provide information on measurement. In other words, how do you create a measure to score students' achievement at multiple levels? We also will talk about collecting data. How are ways that you can put into place where data can be collected and put together, and then finally putting that data together and reporting it for analysis, remembering that the purpose of assessment is to identify achievements as students have received in learning from your program, but also to identify particular deficiencies that your program can discuss and make decisions for program and instructional improvements.
我们在最后一个 video 之后会其中会提到就是如何去设计跟制定的评量的方法，那一些案例、评量尺规或是不同的方式来做学生学习评估的评量，来做介绍。那如何当你的评量的方式确定之后，如何收集资讯？我相信这个对大家都不陌生。那资讯获得之后，如何reporting and data analysis， 就是在整个资料分析、资料提供给系所老师、系所或是不同的层面，这些就整体的一个架构来讲的话，可以提供一个很全面性的知识给大家。